Tolnaftate is an ingredient in Tinactin 1% topical cream, which is used to treat skin infections like athlete's foot, jock itch, and ringworm. It's an antifungal that stops fungus from growing. Some forms of Tolnaftate may also be used to prevent athlete's foot from coming back. This medication is meant to be used only on the skin. Make sure the area is clean and dry before applying the medication. You'll usually apply it twice a day, or as directed by your doctor. The dosage and how long you need to use it for depends on the type of infection being treated. Some forms of this medication may need to be shaken before applying. Check the product package to see if this applies to your medication. Apply enough to cover the affected area and some surrounding skin, then wash your hands. Don't wrap or cover the area unless your doctor tells you to. Don't put this medication in your eyes, nose, mouth, or vagina. Use it regularly at the same time each day to get the most benefit. Keep using it until the full prescribed amount is finished, even if your symptoms go away before then. If your condition lasts after 2 weeks of treatment for jock itch, 4 weeks for athlete's foot or ringworm, or if it gets worse at any time, tell your doctor. If you experience irritation on the treated skin, notify your doctor or pharmacist. Your doctor has determined that the benefit of using this medication outweighs the risk of side effects. Serious allergic reactions to this drug are rare, but seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. In the U.S., call your doctor for medical advice about side effects or report them to FDA at 1-800-FDA-1088. In Canada, call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before using Tinactin 1% topical cream, make sure to inform your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions or other issues. Be sure to also let your doctor or pharmacist know about your medical history and all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using Tinactin 1% topical cream. This can affect how your other medications work and may increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with anyone else. Your doctor prescribed this medication specifically for your current condition, so don't use it for another infection unless your doctor says it's okay. If you forget to use it, you can use it when you remember. If it's almost time for your next dose, just wait and use the next one as usual. Don't use extra to make up for the missed dose. Make sure to store Tinactin 1% topical cream at room temperature and away from children and pets. Do not flush it down the toilet or pour it into a drain unless told to do so. When the cream is expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.